ahead of the game. Call an advisor today at 877-ASK-DEL. That's 877-ASK-DEL. A start to a simpler experience with Windows 11 Pro.
Have you ever tried to pick something out from a sample and then it didn't quite look like what you were expecting? Don't settle for a tiny sample when choosing your kitchen countertops. Come to Pyramid Marble and Granite, where we have a massive in-stock, full slab inventory of granite, quartz, quartzite, marble, and porcelain. Come to see your slabs in person at Pyramid Marble and Granite.
It's 4:30 here on a Tuesday afternoon. Looking beautiful outside. Christi here from HSHS St. Anthony Memorial Hospital.
You give him initials to say, and he can't even say it.
Easy for you to say.
Not that easy. PDQ. Anyway, how nice is it outside?
It's beautiful.
Ah, it's nice.
Awesome.
It's a cool start this morning, but looking good now.
Right, and the leaves are starting to turn. It's getting really pretty out there.
And, that makes me feel achy all over because cold air is coming, and we'll have it soon, and I may need some occupational therapy.
Yes, you might.
You never know. Well, we'll see. I don't know. I'm hoping not. How about that?
Right.
If I want to come visit you, I'm just going to come visit. I don't want to come to get all worked
Sounds
over.
good.
But it is nice to know that if I do have troubles, there's a place I can go to get all kinds of rehab. Okay, what's your shirt say? It says rehab. We will be there for you. That's nice.
Well, and I can see HSHS Illinois.
Right.
Oh, on the back. Okay. Well, Christi's here. She's going to talk about occupational therapy.
Mm-hmm.
First thing, there's therapy, different kinds of therapy. What's the difference between occupational therapy and, like, if you're recovering from surgery therapy?
Well, most people ask the difference between occupational therapy and physical therapy and speech therapy.
That was the word I was wanting to use.
So physical therapy typically more works on leg injuries, back injuries, neck pain, those kinds of things for walking, leg exercises, transfers in and out of a chair, those kinds of things, balance. And for occupational therapy, we work on making sure you can take care of yourself again. That's what it was founded on, was your occupation, even after you retire, is taking care of yourself.
Okay. Get you back to work or take care of yourself.
Right. So we work with bathing, dressing, those kinds of things. If you've had a stroke, like I've talked about before, is getting your arm working again. And then also what we're going to talk about today is if you have a hand injury, arm injury, something like that, then we can work on that too.
Mm-hmm.
Having carpal tunnel surgery, is that a form of occupational therapy after that is done?
Right, so we can work on that. There's lots of different things that we can do, work on carpal tunnel, a broken wrist, broken fingers, if you broke your arm, different types of tendon injuries. Sometimes people will cut their hand and cut a tendon.
Ew.
Oh, that sounds so painful.
Well, and you'd be surprised when it happens when you're trying to get the can off of the lid off a can of vegetables.
Oh, really?
When it's got that sharp edge.
It's pretty sharp.
Uh-huh.
If you pull it just wrong, then you can slice through that tendon on your finger.
I can see that.
See, now I know that that's a reason why I don't cook.
It's dangerous, I tell you.
It is very dangerous. Now, you talked about that, but what about tendonitis?
So, like tendonitis, there's lots of different things we'll do for that. Sometimes we'll do like a heat treatment to kind of help with the pain. Mm-hmm. Okay, we can do ultrasound, which is a pulsed sound wave that can help with that irritated tendon and kind of get it to calm down and so that your body can start to heal it. We'll do that for it. We can do stretches, a soft tissue massage. We can do this treatment that a lot of us are certified in that's called ASTYM, A-S-T-Y-M, and it's a type of soft tissue treatment that helps your muscle fibers realign and kind of heal themselves.
Which is awesome.
Yeah. And so that's a little bit different than what we would do for a broken bone or a broken hand, where we would do that heat treatment, but then we just basically work on range of motion, being able to bend your wrist like you used to be able to, getting your functional grip back, those kinds of things.
I broke my leg when I was 15 in two places. I broke both bones in my lower. I had a motorcycle wreck. It was really stupid.
Okay.
But anyway, I haven't been on a motorcycle since either. So, but I broke my leg. And I wore the cast for 3 months.
Oh, wow.
From my toes to my hip.
Oh,
I mean,
wow.
it was broken pretty bad.
No wonder you never got back on a motorcycle.
Never again. But I didn't have any therapy. I mean, mind you, this was many years ago. I didn't do any therapy, I guess, because maybe I was 15 and I could spring back pretty quick.
Right. You're going to heal faster and you're going to be able to recover faster than if you were already 50 years old when you did that.
Oh yeah, like if I broke my leg now, I would need some working over.
Right, because your bones are in a different state. They're not going to recover as fast. You're not still growing, and
She's calling me old brittle bones. That's what she's calling me.
I was just going to say you're old, George,
well,
but whatever.
That's for sure.
I mean, she was being very, very diplomatic and
she
nice.
was doing well.
I'll just call you
She
old.
would never say that. She was thinking it, though, but she would never. No. But, yeah, it was this difference in age-wise on your recovery. It matters a lot, doesn't it?
And every person heals differently, too. So some people, even if they are, in a later stage in life, in the 50s, 60s, 70s, may still recover pretty quickly, compared to somebody else. And so every person is different.
Okay. All right. So you were talking about breaking a hand or breaking a wrist. What kind of treatment would you do if it was like right on your wrist? Because there's a lot of movable parts there.
Exactly.
What do you got to do with that?
And so, like I said, we would do that heat treatment to kind of warm the tissues up. And what that does is, like, if you had some bone pain or even arthritis in there, then that can kind of help reduce the pain a little bit and loosen things up a little bit so that we can get more motion in there. So we will do that. We will give you lots of exercises to do.
Oh, I bet.
Okay. Mm-hmm. And we'll help stretch you. So if you're trying to get your wrist to move, we're going to try and bend it down, bend it back, turn your palm up, because that's a big one. You got to be able to turn your palm up to do lots of things. Okay. And, sometimes we'll have a patient that needs to be able to carry, trays, or if they're a waitress or something like that, they got to be able to bend their wrist back to be able to hold a plate.
Well, never thought about that.
Mm-hmm. Right. So, and I always tell people, you want to be able to turn your palm up, especially on your left hand, because when you're pulling up to a drive-through, you got to be able to have them give you your money.
Right. Here's your money.
Right. Otherwise, if you can't turn your palm all the way up, then your money's going to slide right out on the ground.
Just use a debit card. Use a debit card and stick it between your fingers and give it to him. It'll be great.
There you go.
That would be the way to go about. But it's probably better to get your hands working right.
Right. Let's shoot for that.
That's it. And right. All right. What is like if somebody's hurting, maybe they broke something, what's an evaluation going to involve whenever you come, when they come to see you? How's that work go down?
So when they come over, they have to have their doctor's order. We'll talk to them about what happened to them. We'll want to see, what type of injury they have. Sometimes we can look on our computer and see their x-ray, and we can see what kind of hardware they put in there, if they had a broken bone, or, if it was, like I said, if they cut a tendon, then we can see what the doctor's protocol is. What exactly do we need to do for that? So we'll check their range of motion. We might check their strength if they're allowed to do that. Like if it's a brand new break, you don't want to check strength. You got to wait for that to heal. Mm-hmm. So we do a range of motion, strength, any other issues that they're having, if there's numbness, if they've had a nerve cut, those kinds of things, and see what their deficits are. And then we want to set goals based on those deficits. So, if you can do everything, but there's one thing that I wish I could do this. Like I said, turn your palm up so you can do whatever. Then we want to set goals based on what you want to work on.
Now, as far as therapy goes, I mean, I know each individual would be different depending on what has happened, whether it's their hand or arm or something. But how often would they need to go to therapy? Do they need to go like 3 days a week for 6 weeks, or is it a couple days, or?
Right, and usually it's 2 or 3 days a week, depending on how much the doctor has ordered it.
Okay.
Because sometimes if it's a certain protocol, then we may have to do 3 times a week, because the doctor wants motion. Say if you did cut that tendon, there is a specific protocol you follow where you have to move those joints. You have to keep it moving. You don't want to pull, but you have to keep the tendon from scarring down.
Okay.
So it gets kind of complicated. But, if it's a broken bone, then we would probably do 2 or 3 times a week, depending on how involved it is. If it's an irritated tendon where we're doing that A-stem, then we do those twice a week. And it could be for 4 weeks, 6 weeks, depending on how severe your injury is.
Makes sense. Okay. Everybody's different, whatever the doctor
right.
says.
And the thing that I really like where we work is every patient gets their own individual treatment. Like the therapist is with that patient one-on-one.
Okay.
Every time.
That's
and
nice.
So, sometimes I'll hear patients talk about when they've gone somewhere that there's several patients there at the same time with one therapist. We don't do that. We like to make sure that if there's something going on, we can keep an eye on that patient, and if something needs to be adjusted, we are right there, and we give them individualized treatment. And I think that's something that should be valued. That it's a really good thing for our therapists, and the patients should be able to appreciate that they get one-on-one treatment with us.
It's not a workout session. It's a rehab session.
Right. Because so we can tailor everything to their needs.
Okay. Very good. All right. Somebody out there thinking, they have to go see their doctor, of course, to come see you. But is that how it works out? They get hurt. They talk to the doctor and say, yeah, I want to come see Christi or whoever.
Right. Yeah. As if they can get an order from their doctor to have them send it to the Workman Sports Complex. It can say, evaluate and treat, or if the doctor has something specific they want us to work on, then they can send that with the order. They can fax it to 347-1558, or if they want to give us a call and find out some more information about what we could do for them, it's 347-1243.
Very nice.
All right.
All right, Christi, thanks for coming in.
Thanks for having me.
And go out and enjoy that weather out there, okay?
That's right. Okay.
All right, there's Christi there from HSHS, St. Anthony Memorial Hospital, and Occupational Therapy.
Yes.
There's just things everywhere. It's crazy.
That's right.
Hey, stick around 20 minutes from now. Greg will have news for you, so stick around right here on the drive home.
Classic hits live here.